do one quick card. This is a question from Lynn. After so many years without government-run health care, why do we have to rush this legislation? Why not consider other plans? Why don't we include government growth, but rather tort reform, plan portability, and incentives for business? I guess my short answer to that is, this is not really being rushed. We've been talking about many of these similar concepts for not just for months, not just for years, but for decades. We finally have people at the table to actually put some of these pieces together in a way that can actually pass. Tort reform has been done in previous years substantially, and within the plan that's on the table, there is plan portability and tax incentives for businesses. So I wanted to get that question in, and let's go back to the front mic.
Yes, thank you, Congressman. Thank you to the college and the congressman and everybody for having this affair. My name is Steve Hollis. I'm with the American Federation of Government Employees. And our union has members who already provide very positive health care and health care administration in this country. But I want to talk first and raise one question that hasn't been raised from a bit of a personal standpoint, in that I'm just slightly above that 4 times the poverty level that you all are talking about, okay? So I won't get any subsidies. Now, I currently pay over 10% of my income for health care, you know, because as a federal employee, the government only pays 70%. 30% has to come out of my pocket. It's the same as the members of Congress, or at least your staff have. And and yet, with that 30% in premiums, plus at least twice that amount in co-pays and in deductibles and in all the other horrible, you know, exclusions that are provided by the only health insurance option that I can afford, then I have to spend a lot of my hours of time that's either I'm supposed to be doing my job but I'm on my break or lunch, or time that I'm supposed to be spending with my family. And I think my time and your time and everybody else's time is valuable. I had to go this year, spend probably 100 hours just trying to get my insurance company to pay me instead of paying some of my providers who required that I pay the full bill up front. But they just automatically had it set up to go pay the providers. The providers kept sending the check back, you know, and it took like 6 months and going to a regional vice president of this insurance company. Now, what kind of efficiency is that? What does that tell us, you know, about the waste of human resources as well as money? So that's all to lead into my question, and then I want to raise another point. Are you going to tax my benefits? It's my understanding the House plan is not going to tax workers' benefits, which is because I do at least this 10% of my income that goes on health care. At least I can, you know, not have to pay taxes on that under the current system, right? And I want, you know, and so I know the Senate is considering, and President Obama has even said we might consider that, but a lot of us workers who work, you know, and have fought and negotiated, you know, to have decent benefits, you know, would be pretty upset, you know, if that little bit of tax was added to us. The second point I want to make goes back to our union members. You know, there was an article in the New Yorker that got a lot of play maybe 6 months ago by this Asian guy, I can't pronounce his name, who was an advisor to Clinton, you know, who talked about you have to have a path-driven approach to health care reform. It has to be built on something you already have. We already have one of the best medical care systems in the world in our veterans health care system. You know, what could be, you know, and any country, you know, are we saying, those of us who think the public sector can't do things right, that, you know, that's why we dump the public sector on our veterans? You know, we created the veterans health care system because we want to honor the people, you know, who have served this country in war. And it's the best health care system, both cost-wise and quality, in the world. Then we have the Medicare system, which the John Conyers bill is based on. I guarantee you, at least on the administrative stuff, now I can't speak very professionally to the, making sure the doctors and nurses, are adequately paid and recruited. But on the administrative side, I guarantee you that the government workers could do a better job at a lower cost, and we could absorb some of those private insurance company workers you're worried about, because we don't have to make a profit. The government doesn't have to make a profit. These insurance companies profit billions and billions and billions of dollars off of our poor health. Now, my second question, my wife is a minister, so she always, Reverend Hollis always wants me to bring up the Bible, and I believe the Bible and many other holy texts speak against usury and speak against exploitation. And my second question is, how can any God-fearing person who has any morals think that it's moral for companies to profit billions and billions of dollars off of people's health? And we need to change that.
Thank you. I just wish you'd get a little more passion in your presentation. But seriously, thank you. You brought up several good points. I think maybe your second question was about the public versus private. And seriously, you're right. The government gets bashed for a lot of things, oftentimes deserved, but the fact of the matter is that we do some things actually quite well. Social Security is a good example. Medicare, Medicaid, and also you mentioned the VA. I mean, some of our most honored and revered citizens that have served and fought for our country, they have a public health care system. And it is not perfect, but it is generally considered to be very professional and very well run. So the other thing I wanted to mention, absolutely, in terms of the savings, in terms of the administrative cost, that's part of what's going to be achievable through this healthcare exchange, through competition, and I think it's really one of the most important parts of really bending that cost curve and to squeeze these savings out of our healthcare system, while at the same time getting us to better quality. And I know that there's going to be some folks on our panel that want to weigh in on your questions. Yes.
You made an important point, Steve, about affordable insurance. It's not just the premiums you pay, but these out-of-pocket costs. And one of the things the House bill does is that for those Americans who make over 400% of poverty, about $70,000 for the average family, it builds in that there will be affordability protections in the exchange. There is shared responsibility in the bill that says we all should have insurance, but that insurance should be affordable. It then defines a basic minimum package that includes outpatient, inpatient care, prescription drugs, mental health benefits, and then specifies what is a reasonable, affordable, out-of-pocket expense. Really important for us to follow this through. One thing that is missing in the House bill that maybe Representative Carnahan can help us with is an explicit provision that would say we will only be required to purchase insurance if there is affordable insurance available. Seems to be the intent of the bill. As a lawyer, I'd like to see that language in there. So let's keep an eye on that.
Thank you. I also want to add you are correct that the House bill does not tax benefits. I don't think we should tax benefits. And the way the bill is structured now, it is completely paid for. It is completely budget neutral without having to do that, and in fact achieves a surplus over a 10-year period. So it's a balanced package right now without doing that, and I certainly would oppose any effort to do that. Anybody else on the panel? Andrea.
Just a quick note. I regulated insurance companies in the state